Good evening, everyone. My name is Miriam Innocent, and today I will be presenting on emotional and motivational development in panic disorder, a brief overview of the physiological, neurological, and psychological aspects. So, the introduction of panic disorder. What is a panic disorder? It is a sudden recurrent panic attack with physiological symptoms. Those physiological symptoms include increased heart rate, feeling flushed, clammy hands, and sometimes dizziness. Its prevalence in Canada is 3 to 5% of Canada's population. Population in Canada is approximately 40 million, so 3 to 5% still puts us at approximately 4 million people. There is an increased incidence in women, and of course, its impact, the impact of panic disorder cannot be understated. What is the purpose of this presentation? We want to explore the physiological, neurological, and psychological aspects, and that includes the importance in exploring that will sort of help us identify the appropriate treatment. Neurological aspects include the dysregulation in the brain, specifically in the amygdala, and neurotransmitter imbalances. Psychological factors include unhelpful thinking patterns, heightened stress response all plays a role in the disorder's development and maintenance. And its importance, its clinical implications, and emotional and motivational relevance is that effective diagnosis and treatment improve patient outcomes and reduce long-term disability. We know that this affects people's daily functioning. It affects your emotional regulation. Over time, it can lead to heightened anxiety. This can lead to avoidance behavior and reduced motivation. This increases health care utilization, and it reduces your quality of life. So, what is actually happening inside of the body when somebody is diagnosed with a panic disorder? The brain structures involved is the amygdala, and the amygdala is responsible for processing fear and triggering a panic response. The HPA axis dysfunction, coined as hypothalamic pituitary adrenal axis, this overaction leads to excessive stress hormone release, contributing to panic symptoms. In the prefrontal cortex, what happens there is we have an impaired regulation of fear responses, and that impaired regulation of fear response is what provides difficulty in controlling irrational fear. In the autonomic nervous system, we have an overactive sympathetic nervous system. So this leads to the physiological symptoms. So that is increased heart rate, hyperventilation, heightened arousal during panic attacks. And then with the parasympathetic response, we have just this overall inability to function, resulting in a difficulty in calming down after a panic episode. The neurotransmitters and hormones involved include serotonin. We know that there is a dysregulation linked to serotonin, which increases anxiety and panic attacks. Norepinephrine, there's an excessive release, which heightens the fight or flight response, which we'll cover on the next slide. And GABA, which is the gamma aminobutyric acid, its deficiency leads to a reduced ability to inhibit fear and anxiety responses. Cortisol, we know, is a stress hormone. This elevated levels of this hormone just adds to the prolonged stress and panic symptoms. And then adrenaline, specifically epinephrine, this increased secretion amplifies the physical symptoms of panic, such as the high heart rate and sweating. So, what is happening? The fight, flight, and freeze response. These are the mechanisms and effects on panic disorder. So this is an automatic physiological response triggered by perceived threat. So it prepares the body to fight. So that's when that's when that person wants to confront what's happening, feels that they're in danger, feels an intense feeling of aggression, muscle tension, and urgency. Something has to happen right now. Some people feel flight, they need to escape. This leads to avoidance of triggers. And unfortunately, that avoidance of triggers reinforces anxiety and panic. And then freeze, that's when they feel numb, detached, and unable to move. And when they feel unable to move, they feel also unable to respond, which increases that heightened sense of panic. Of course, there's variability in response patterns, but all those variabilities just add to prolonged long-term effects. We know that the effects of chronic dysregulation lead to long-term anxiety, heightened sensitivity, and maladaptive coping mechanisms. So what are some of the causes and comorbidities of panic disorder? There's genetic predisposition. Any family history of any anxiety issues can be passed down. We know that there's environmental triggers such as traumatic experiences, chronic stress, and life changes, which can contribute to developing a panic disorder. And of course, cognitive and behavioral factors. That's maladaptive, so unhelpful thinking patterns, hypersensitivity to bodily sensations, and avoidance behaviors, which reinforces panic symptoms. Neurobiological influences include the dysregulation in the neurotransmitter systems, and those were the hormones and neurotransmitters we spoke about before. And then common comorbidities include generalized anxiety disorder. And so with that, that is just experiencing chronic worry and excessive anxiety about various aspects of life. Depression, this tends to happen when you have persistent panic attacks, and avoidance behavior can lead to depressive symptoms. And substance use disorders, people will self-medicate and may turn to alcohol or drugs as coping mechanisms for managing anxiety and panic attacks. Some people will develop agoraphobia, and that's the fear of experiencing a panic attack in an uncontrolled environment, which means they will not expose themselves at all. So, for example, if you were afraid of large crowds, it can get so severe that people will not even venture out into a grocery store, let alone a concert. PTSD, post traumatic stress disorder. These are trauma related disorders can exacerbate panic symptoms and increase sensitivity to perceived threats. So now that we've sort of covered what are the causes and common comorbidities, what are some of the evidence-based treatments and pharmacological interventions that we use today? So psychotherapy, one of the gold standards is cognitive behavioral therapy. It's considered the most effective treatment. It helps clients identify and challenge the unhelpful thinking patterns and actions that contribute to panic attacks. Exposure therapy, this is a gradual exposure to the panic-inducing stimuli, helps reduce avoidance behaviors and desensitizes individuals to triggers. A mindfulness-based therapy, this helps teach individuals to manage anxiety through present-focused awareness and acceptance. And then when we talk about pharmacological treatments, we tend to talk about SSRIs, which are selective serotonin reuptake inhibitors, which is the first-line pharmacological treatment that helps regulate the serotonin levels and reduce panic symptoms. We also talk about benzodiazepine, which is typically used for short-term symptom relief. An example of that would be a lorazepam, something sublingual that you could put under your tongue. Some people have quite a bit of um, anxiety or panic associated with flying, but there's also a risk of dependence. Beta blockers reduce the physical symptoms like rapid heart rate and tremors associated with panic attacks. And then there's therapeutic techniques. So breathing techniques and relaxation training. This helps control the hyperventilation and reduces the physiological arousal. And biofeedback therapy uses real-time monitoring of physiological responses to teach self-regulation techniques. Lifestyle modifications, of course, include exercise, healthy nutrition, and sleep hygiene to reduce overall anxiety levels. Some cultural considerations include um, understanding that there's some stigma and the presentation around those symptoms may vary based on people's cultural beliefs. There's barriers to mental health care. There could be language barriers, financial constraints on being able to afford an assessment, and then of course the lack of culturally competent providers. The other piece is that we've done a lot better. However, there aren't that many culturally adapted interventions, and there's differences in coping strategies. This comes from the fact that there are more familial supports when people are coming from more of a collectivist or East Asia. So those are some things that we need to keep in mind. And then support. A lot of the support may be based on religious practices or alternative medicine. Support systems and resources. So that is peer support groups, group therapy, psychoeducation, just increasing awareness. We do that in schools. We try to teach our young ones. Community-based resources are mental health clinics, helplines, and crisis intervention um, organizations. And then, of course, online like telehealth, being able to access virtual assessments, and then, of course, workplace and school accommodations. Conclusion and future directions. So, panic disorder is a complex mental health condition influenced by genetic, neurobiological, psychological, and environmental factors. There is an importance to highlight the multidisciplinary treatment and that approach, and that is the fact that effective treatment involves a combination of psychotherapy, medication, and lifestyle modifications, which is tailored to that person's needs. There's a huge impact on emotional and motivational development because we know that panic disorder affects emotional regulation and motivation. This is what requires targeted interventions to improve quality of life. So future direction. We know that we want to that there's ongoing research right now into neurobiological mechanisms, of course, cultural considerations, and new treatment modalities will enhance our understanding and management of panic disorders. And these are the references. And thank you for listening.